Okay, so we're going to kick off a little bit early, about 30 seconds early, just because we have a lot to cover today. Thank you so much for joining us today. My name is Emily Kunish, and I'm the Senior Marketing Manager here at First Stop Health. A few things to note before we kick off today's buzz. This session will be recorded, and we will send it out in a follow-up email sometime early next week. And please drop any questions that you might have into the Q&A, and we will do our best to get to them. However, we most likely will not have time, so please be sure to follow up with your First Stop Health rep, or you can email marketing@fshealth.com. Okay, so I am so pleased to introduce Elena Gambin, Chief Strategy Officer and Chief Growth Officer here at First Stop Health. Elena, would you like to take a second to introduce yourself?
Hi, everybody. Yes. And for those of you who have joined us on these before, you know who I am. You're probably sick of hearing my voice. I will say I am live from the Zoom app on my cell phone today because my Wi-Fi is down. So I apologize for the maybe vertical video that you're getting, but hopefully I'm coming in loud and clear for you all today. I am honestly extremely honored to talk about the subject that we have today, which is some of the enhancements that we've made to the First Stop Health solution, primarily because it represents what I think is a profound commitment to always trying to do better for our patients, and is representative of a tremendous amount of work that our product and our clinical teams have done to get us to this place. So I'm going to start with a little bit of a background on who we are, if anybody's new, and then we'll dive into some of the awesomeness that we have going on at First Stop Health in 2024. First Stop Health is a direct contract virtual care company. We serve over 1,000 employer clients nationally and almost 1 million members nationwide across behavioral health, physical health in the form of virtual primary care and virtual urgent care. And the industries that we serve are broad. The funding structures that we serve are broad. The size of clients that we serve is broad. We have 100 life law firms all the way to 20,000 life part-time populations in retail and hospitality. I will say, though, that the thing that unites all of the clients that we have, some of the ones that you see on the screen, is that every single client who has come to us because they want to fundamentally change the engagement problem that they have in their population. That engagement problem might be showing up in the form of overuse of ER because no one has a primary care physician. It might be showing up in no one having any prevention activity. It might be showing up in folks who have serious mental health needs not accessing care. And so for all of the clients that we serve, and as a company, our North Star and our ethos is around utilization. If you'll flip to the next slide, I'll talk a little bit about and visualize for you why that utilization is so important. So I believe, and you can show statistically in our numbers, that the thing we do better than every single other virtual care company in this market is achieve high levels of utilization. It is the thing that guides our decision around new products, around revenue structure, around how we hire our client care teams. And the reason it's so important is the thing that you see on the top of your screen right now, which is that we can all agree the costs of maintaining an employer-sponsored health plan are rising at an exponentially higher rate than they ever have before. The average increase in 2024 was 7%. I personally talked to clients with a 20, 30, and 40% increase in a not uncommon way. And that which we can control of this increase, part of it is market, but that which we can control of this increase is directly related to the underlying health of a population and the patient activity occurring in the plan. So if you'll click again, that is what this bottom part of the screen represents. High engagement direct care delivers savings that effectively acts as a buffer between the patient population that you see on the bottom of the screen and the health plan. The more people that use a solution like First Stop Health as a first or only resource, the more substantial that buffer, that savings. That savings is coming from immediate cost diversion steering people away from an emergency room when it's not necessary. It comes from better steerage and site of care choice when patients are in fact using their plan and seeing specialists or getting MRIs. It comes from earlier and better rates of prevention activity. It comes from better chronic disease management. It comes from helping patients choose prescriptions that are lower costing and avoiding pharmacological intervention when it's not necessary. And we get this utilization through creative, personalized engagement and a patient experience that I personally think is often the direct opposite of the most of healthcare. I like to say that if we're not getting a thank you from the patients that we support directed to their HR teams, then we aren't doing our job right. Our minimum of service level is to be there for patients and to create an environment of trust. And we believe so firmly in this utilization, driven by this experience, that we are contractually guaranteeing it. In primary care, we contractually guarantee 30% utilization, or we refund portions of the fee to the employer. And so we are really trying to create a value-based arrangement and a true medical home for our patients. But the focus of today's buzz is what's new. So if you'll flip to the next slide, we're going to talk a little bit about the solutions that are new in the market and how we've enhanced the existing solution sets that we have today. So the first, I want to focus your attention on the left-hand side of the screen. We've made enhancements to our engagement process, our savings story, and our population health reporting. And all of these enhancements are just baked into the value that we are going to deliver to all of our existing clients and all new clients. On the engagement side, we've made investments on creating an app and a website that's now available in Spanish, making sure that all of our virtual primary care clients have enhanced understandings of what we call client or patient personas, patients who interact with us differently based on their healthcare experiences, and we're tailoring engagement to them. If clients want, for an extra fee, to have on-site biometrics or on-site presence of First Stop Health in the form of a care corner with key durable medical equipment on site, we are now able to do those things. So we are expanding the tendrils of reach that we have for our client base so that we can not only be a virtual home, but have a physical presence for clients that really do need it. We've also enhanced our savings story. Along with our performance guarantees, we've always provided very fair-minded approach to calculating savings. And excitingly, we've enlisted the support of actuarial consultants to help us hone and add credibility to that savings calculation. And you will see that effort reflected in the impact analyses that we provide for new prospects. And finally, the population health reports that we're now delivering in primary care are a massive investment in our belief that savings is just one part of the story, but the ability to move the needle on discrete health metrics is equally important. So we'll be able to show information on clinical risk reduction in certain key metrics, improvements in preventive care adoption over time. And that will help really build out the picture of not only how we're helping to save the patient and the claim money, but actually changing how people interact with their healthcare. But the bigger focus for today is on the new services that we're bringing to the market in 2024. Why did we bring these services to the market? Well, first and foremost, it is because folks like yourself asked us for more. Our mental health is fantastic and amazing at getting access and engagement, and clients and consultants were asking for longer-term mental health support. And so we're doing that. Our primary care is amazing at converting patients from no primary care relationship to a primary care relationship. And our clients asked for more navigation handholding. And so we're doing that. So I'm going to spend the rest of the time today talking about what these new solutions are and how it fits into the broader story of First Stop Health. If you'll click to the next slide, the best way to describe why we made these investments and what they do is that we are looking to not only improve upon market demand, but expand the level of risk in a patient population that we are able to touch. So you can kind of click through all of the way, and I've basically wanted to outline for you what each of these solutions that we're about to talk about, where they fit in the full spectrum of managing risk. Every population has some low risk, some high risk, some medium risk, and some extremely high risk patients. And now with some of the enhancements that we've made on navigation and mental health and case management, we're able to tackle this high risk population in a much more sophisticated way, which means we can do more in terms of intervening from a health perspective and a cost perspective. So what does this look like? Well, if you're brand new to us, or even if you're familiar with us, on the next slide, we are a 3-service platform. You can click all the way through and see all of the different service sets that we have available. Our flagship product was urgent care. This is the heart of our patient engagement engine. People come to us when they need help in the moment. This is 24/7 access to virtual MDs or DOs on average in less than 3 minutes. We also have virtual mental health available 1/1 of 2025. This mental health product will be expanded and will grow to include not only short-term counseling within days, but long-term counseling for individuals and families, as well as access to primary care physicians for prescriptions. Whole mental health will also include differential levels of counseling. For patients who maybe aren't necessarily ready for a psychiatrist or a licensed clinical social worker, they'll be able to talk to a behavioral health coach about specific goals that they have, especially if they kind of cross the boundary of physical and mental. So we'll have a tobacco cessation program, a wellness goal program, and the availability for these coaches to be wraparound support, both in between and alongside the relationship that they have with their counselor. And lastly, primary care. So today, primary care is scheduled visits as soon as next day with your virtual primary care physician for chronic disease management, prevention, and steerage. Available 8/1, it's being expanded at an additional cost. So in addition to scheduling with your primary care physician, clients who buy into enhanced primary care will have access to navigation from nurses, inclusive of clinical and benefit navigation, a network of health coaches and specialists like diabetes educators and tobacco cessation specialists and nutritionists who can wrap around the relationship with the primary care physician. In addition, any client who would like to add on true clinical case management for high acuity conditions like someone undergoing oncological treatment or surgery, they can opt into our case management program. Additionally, as I've mentioned, clients with enhanced primary care can now take advantage of on-site biometrics, which allows for clients to gain a baseline understanding of population health, maybe even before we interact with them, and better help patients guide into a primary care relationship. So for those of you that are not new to us and you understand what primary care is today, I want to take a moment to explain and clarify what is really the difference between the standard primary care option that we have today, which will continue to be in the market, and the enhanced primary care option that is a higher price point because it comes with a lot more support. Today, primary care is access to those doctors, smart referrals for in-network care, reminders to follow up on treatment plans, and steerage to other available benefits, including integration with wellness programs. Enhanced primary care for the clients that need it provides enhanced clinical and benefit navigation, like coverage questions and bill review support, that health coaching and specialist support that I mentioned, including things like healthy mom and healthy baby coaching and weight loss support, which is a very important topic right now, especially given the GLP-1 conversation, and case management, as well as biometric on-site events. And I've shown you here what this combined solution is capable of. And I'm showing you this because there is a profound impact that primary care and true navigation can have when they wrap together cleanly. Things like 32% of patients having a decreased A1C level by at least 1 point. Things like 44% of our patients losing weight at an average of 12 pounds. Things like 80% of patients lowering their blood pressure and stabilizing their glucose after just 5 visits with us. So again, Cost savings is only part of the story here. Actually moving the needle on making people healthier is why we exist. We're going to do the same exercise with mental health. For those of you that are familiar with our mental health today, you know that it is short-term solution-focused counseling. Talk to a doctor, or rather a mental health clinician, like a licensed clinical social worker and a psychologist, in a matter of days. And we support provider patient choice around who their clinician is when it comes to matching them with domain expertise, age, gender, demographics, so that a patient can build trust and feel comfortable. In addition to the short-term solution-focused counseling, our enhanced mental health is going to include longer-term support, not just an average of 3, 5, 8 visits, but a patient who needs ongoing weekly support from a clinician with regularly scheduled time now has the opportunity to do that. We'll also be able to give patients access to primary care physicians in coordination with their counselor for the exclusive purpose of evaluating for pharmacotherapy, like anti-anxiety and antidepressant medications, even if a client doesn't have primary care. And this is important here to note that we are never prescribing controlled substances. These are non-controlled mental health medications that are appropriate for a virtual setting. And then lastly, the health coaching. Some of the statistics I want to show you here are extremely impressive around our ability to do reduce risk in depressive populations, reduce risk scores. 66% of patients report reduced risk of alcoholism after engaging with this long-term mental health program. And 74% of patients report a higher sense of purpose. So many of you might be asking, how do you already have these amazing statistics about this solution when it's still being brought to the market? And the answer is, we have had the pleasure of acquiring a company known as SentryHealth, who has been doing all of this work for years. And they are so good at patient engagement and mental health and navigation that we've wrapped those services into our solution, and we're able to now produce a much stronger combined story in this way. But our DNA, despite this, is never shifting. And so I want to close with a comment about engagement on the next slide. No matter what we do, our goal is to make sure that patients feel seen and comfortable enough, and that the barrier to access is low enough that they can ask for help and get it when they need it. And the way that we do that is a couple of different things. So number one, by creating an environment of accessibility. There should be always support for a patient across phone, app, web, and if a patient only wants to interact with us over voice and have a live human being every time, they have that ability. There should be no pre-registration. Patients should get access in minutes. There is $0 for the patient to use the solution. So you can see we're reducing this activation threshold or this difficulty. On top of that, I've already alluded to the outbound engagement campaigns that we're providing, both before and after a visit. But what these new services have done for us, and what I've highlighted in gray here, is it has given us additional entry points into the system. Not every patient we have is going to proactively come to us and say, I want to establish a relationship with a primary care physician. And so it's important for us to meet patients where they are. Maybe a patient starts at an on-site biometric checkup, sees their levels, meets with a health advisor, and then funnels into a primary care relationship. Maybe their first visit with us is at 2 a.m. in our urgent care when their kiddo is sick, and we build trust, we help them, and then guide them into a relationship with a primary care physician. Maybe their first interaction with us is a response directly to a wellness program that their employer has set up. Regardless of where they start, our goal is to move them into a higher quality clinical care path and be a virtual first, not virtual only way for them to better manage their healthcare. So if you can't tell, I am so jazzed about these new solutions. I think we are delivering something that is profoundly good, and we care a lot about how patients feel in this. If you have any other questions, I highly encourage you to reach out directly to me or to the marketing department or to your director of sales, or if you're a current client or current broker with us, your client care team or your upsell team, and we would be more than happy to support you. Thank you so much for tuning in. Appreciate it.
Thank you so much, Elena. And it looks like we have just, a minute left. So I just want to remind everybody that we do have several benefit buzzes coming up. So be sure to register and we would love to see you there. I hope you have a wonderful rest of your day and a great weekend. Thanks again for joining us.